Good evening. My name is David, and today I will be talking about tuberculosis. Many people do not know what tuberculosis is. Tuberculosis is a disease that has been claiming the lives of many innocent people since 1882, according to the CDC. I've done research on tuberculosis recently in one of my college classes, and I feel like this is worth sharing. Tuberculosis is a disease many people are not familiar with, especially since there are different types of tuberculosis. Many people may ask, what is latent tuberculosis infection and tuberculosis disease, and what's the difference? It's better to know as a person what type of tuberculosis is which and what they do to the human body. Tuberculosis, also known as TB, is a disease caused by bacteria called Mycobacterium. This bacteria usually attacks the lungs but can also attack other parts of the body, such as the brain, the spine, and the kidney. It can also spread to other parts and can even infect other people. Latent tuberculosis infection is really having the tuberculosis bacteria within your body, but it remains inactive and can remain inactive for a lifetime. Having a weak immune system can activate this bacteria and cause a tuberculosis disease, or however, if you have a strong immune system, this can help fight off the bacteria. The difference between these two is that tuberculosis disease is far more dangerous and causes the lives of people, as for the latent tuberculosis infection is not as dangerous. Although many people may know what tuberculosis is, they may not be familiar with the symptoms. Latent tuberculosis infection, tuberculosis disease have different symptoms, however, some may be alike. People need to be well aware of these symptoms and to better inform themselves of such diseases. Latent tuberculosis, however, has no symptoms, but tuberculosis disease symptoms may include chest and pain, coughing up blood, experiencing chest pain, experiencing chills, bad cough for more than 3 weeks, weakness and fatigue, weight loss, and so on. It usually depends on the area infected. But both can be alike in some ways. For example, the LTBI tuberculosis can quickly become activated and can possess the same types of symptoms as the one as tuberculosis disease has. Many people may or may not be familiar with the symptoms, but have no clue about how to catch it early and what to use against it. You may also wonder, how can someone get tested for LTBI or TB disease, and what kind of vaccinations are used? Since both of these diseases have different effects, there are different tests and examinations people must take in order to find out if they have LTBI or TB disease. To get tested for LTBI, one must complete a skin blood test, chest x-ray, which is a normal chest x-ray, with a negative septum result. When it comes to tuberculosis disease, however, you must complete a skin blood test of normal chest x-ray, positive sputum, smear, or culture. And currently the vaccination is the Bacilli chlamydia guerin, also known as the BCG vaccination. By following the list on how to prevent tuberculosis, could reduce the number of those infected and can stop the disease from spreading. In conclusion, tuberculosis is a disease that many people are not aware of and or familiar with, especially since there are different types of tuberculosis. People should be well informed about tuberculosis and the types of tuberculosis because of its severe symptoms and outcomes. All in all, tuberculosis has been around for a long while. However, as the years go by and there are more and more technological advances, medicine is being made to help stop such diseases